I'll just shortly present the topic of lung neuroendocrine tumors because my partner is stuck in traffic from Jerusalem. She's supposed to come in the morning, but she sent the presentation. So before the patient, Amnon will come and tell us about coping with the disease. Just briefly, I'll talk about neuroendocrine tumors in the lung. Are a total of 2% of lung tumors, and approximately 25% of all NET tumors. They're more common in women than men. They can appear in the framework of the M1 syndrome, of which you've heard. We have 3P, pituitary, parotid, and pancreas, and there are a number of other organs that are called minor in this syndrome. We have the thymus gland, the adrenal gland could be affected as well. Now, mostly the NET tumors in the lung are called typical tumors. They have a slower progression, and a smaller percentage of them are atypical NETs in terms of their histopathology. We look at the tumor tissue, and according to the mitosis number and other characteristics, we can determine which type of tumor we're looking at in terms of the prognosis, its aggressiveness, and the treatment, means of treatment, etc. Many times, mostly nowadays, when most of us go and do blood tests just to make sure that everything is all right from time to time, we identify these tumors in chest imaging or CT that we do for other reasons. We have lung infections that incurrent lung infections, and sometimes we may have the carcinoid syndromes involved, and one of its sources can be lung tumors due to serotonin and other hormones activity. And we can have diarrhea, shortage of breath, etc. In very small percentages, these tumors may secrete hormones that are not secreted normally from the lungs. And we mentioned the Cushing syndrome, HCTH secretion, for example, which is a hormone that's secreted normally from the hypophyse, causes the rise of cortisol in the blood. So these tumors might secrete HCH and CH, and sometimes other hormones such as growth hormones, etc. The diagnosis, as I said, can be done just haphazardly because of blood tests or due to clinical manifestations that are linked to repeated lung infections or excessive secretion of hormones. And in terms of treatment, we have quite a few treatment alternatives, and of course, the first things first, and this is true to all NET tumors, we want to take out the tumor via surgery, but we have also other alternatives, somatostatin analogs, either standard or radioactive. We can have radiology. We can treat the liver if we have metastasis in the liver. We can use afiniton, etc. I would like to invite Amnon, who's one of our patients who has a lung tumor. And we've been accompanying him, and he's been accompanying us for quite a few years. Thank you for coming to talk.
לא נורא מהר.
מישהו מקשיב לי, אני יכולה...
כן, 3 אנשים על פניו.
על פניו. Well, I don't know what I did with his presentation because I had it. So he'll just talk and read from his paper. Hi everyone, my name is Amnon, and my story begins in 2006. I was working, volunteering in Sheba pool as a hydrotherapist, and in the framework of my work I had to be fit, so they sent me to do tests. I had an occupational doctor, Dr. Marina Trechinsky. She insisted that I do a chest imaging, and she insisted in a way because I did a MAN2 test, which is a test that detects tuberculosis, and I had 10 millimeters results, and she insisted that I do the chest X-ray, and they found something on the top lobe of my left lung, and of course they immediately began tests, including CT, and then other imaging, and in May 31st, 2006, Dr. Minwan Sautia took out my left, a lobe of my left lung, and they told me, great, you'll live until 120. Why am I saying that? Because I was on lung monitoring only. I wasn't under oncological monitoring, and nobody told me I had to be under oncological monitoring. And every 6 months, I used to come, do a CT. They used to test my lungs. Everything was great. Go home. At about 2010, 2011, I began feeling bad. What do I mean by saying that I felt bad? I had headaches, I was blushing, I had weakness, I had itching in my legs, I had breath issues. There was no one who tied the knot. I remember that I came to Professor Glesberg, and I told them, and they said, it's like you're reading the symptoms out of the book. And then, out of desperation, truly, my wife was sitting here, and me decided to go to CT. I asked for a referral for CT. I did my CT, and the doctor said, "Your lungs are great, but you have another present. You have metastasis in your liver, on your lung envelope." Then, from then on, I went to Hadassah and Carl. The road was short to Hadassah and Carl. Professor Rosman. I was treated, had 4 treatments of PRRT, and for me, they were really successful. Because I think the disease stopped for me. I hope that I'm not rushing it, but when I came there, the 5-HIA indexes were perhaps hundreds of percentages or thousands of percentages off the charts, really. Regarding my medication, once in 28 days, I take sandostatin 30 milligrams. I take other normal medications for a guy in my age. to prevent cholesterol. That's inherited from my parents, I think. Vitamin D, that for some reason is always on the lowest threshold. I don't know why. Nobody can tell me why. I was asked to note a few important points. So what I can say is that one day after I get the injections by my wife at the sandostatin, I have a hard time waking up in the morning. Beyond that, I have no other symptoms. Okay, I have a bit of pain in my butt, but because it's a tough injection, and it's true that my lung volume is smaller and I have sometimes difficulties breathing, and all sorts of lung doctors forced me to take various inhalers, some with steroids, and a few years onwards I saw that it does me no good. So I stopped it. I just took it off the shelf. Mint candy, I always have mint candies, and it does much better work for me. But I do sports. I swim and I do fitness every other day. And if we'll get to the conclusions, which is the optimistic part, think positive. It's good for those of you who are healthy also. I'll just read what I wrote. Listen to your body and pay attention to what's going on with your body, because no one can feel exactly what you're feeling inside. No, nobody can feel what you're feeling. Always do sports regularly. Even if you're under treatment, I remember that even when I was in treatment, I made sure to do sports, and from my experience, I think that it can only do good. Now I have two sentences that I credit Charlie Chaplin for, who celebrated his 120th birthday recently. First of all, nothing is forever in this life, not even our problems. Secondly, the most wasted day in your life is the day that you did not laugh on. Now the last two sentences are mine, and I believe them, and I always say them. Live every day as if it's your last day. And remember, what does not kill you just makes you stronger. Thank you.